Good morning, students. Today we are going to learn about the terms which describe the muscles. The muscles are described by the following terms. There are different terms present to describe the muscles. The muscles in our body constitute the muscular system, which is attached to the bones, and it's the endoskeleton which plays a very important role in the movement of our body. So this muscular system, I have already discussed about this system. The muscles which are present in the muscular system are attached to the bones, and the terms are of different types describing the muscles. The muscles are described by the following terms, and this portion is for DMLT second year students. So the first one is origin. The first term which is described for the muscle is origin. The fixed point of muscle attachment is called origin. The fixed point of the muscle attachment is called origin. The muscle is having 2 points, and the one point is fixed to the bone, and that fixed point is called the origin of the muscle. Next point, the attachment site doesn't move during contraction. So during the contraction or during the movement of the muscle, the attachment site doesn't move. The origin will not move. It doesn't move. Then the next point, the origin is proximal or closer to the body. The origin is proximal or closer to the body. Next point, one end of muscle is fixed where it is attached to the bone to provide stability. So this origin of the muscle provides the stability to the muscle because its one end is fixed and is attached to the bone. One end is fixed and attached to the bone, and this provides the stability for the muscle. Coming to the next point, most of the skeletal muscles are attached to bones by tendons. So most of the skeletal muscles, the muscles which are attached to the bones, are attached to the bones by tendons. Most of the skeletal muscles which are attached to the bones are tendons. Next point, the biceps brachii performs flexation of the forearm as the forearm is moved, is the example for origin. The biceps brachii performs flexation of movement of the forearm, and this is nothing but an example for the origin. Now coming to the insertion, there are 5 to 6 points present in the origin. I will give the notes to you people, so you go through the notes. So insertion, second one is the insertion. The first one is the origin, second is insertion. It is opposite to origin, in which the other end of the muscle moves when contracted. So this is quite opposite to the origin. The insertion is quite opposite to the origin, in which the other end of the muscle moves when contracted. The other end moves when contracted. The insertion is usually distal or away to the body. It is always away to the body or distal to the body. Next point, the insertion provides free movement to the bones and joints. The bones and joints are moved freely by the insertion, by the insertion of the muscle. Insertions includes movement of bones, example walking, bending, where one bone acts freely and the other remains stationary. One bone acts freely and other becomes stationary. The examples of insertion are walking, bending of the body or the movements of the body. Next one, when the muscles contract, the origin pulls the insertion closer. The origin is a fixed point and does not move, but the insertion moves. Bones act as levers and muscles as pulley. Bones act as levers and the muscles act as pulleys. So this is the insertion. Coming to the third one, that is the belly, B-E-L-L-Y, belly. It is the sum of all the muscle fibers in any given muscles. Here the muscle fiber are grouped into bundles. Around 150 fibers may be there and it is called fasciculi, which is the contractile part of the muscle. Contraction of muscle belly pulls on the tendon and the bone to which it is attached, example biceps and biceps and brachii in the upper arm. Next point, there are three types of muscle bellies. The first one is the short muscle belly, second is long muscle belly, and the third is the intermediate muscle belly. The short muscle belly, it means the muscles attached high on tendons, that is tendons are long and muscles are short. Tendons are long and the muscles are short in the short muscle belly. In the long muscle belly, muscles attached very low on tendon, that is tendons are short and muscles are large. Tendons are short and the muscles are large, just opposite to the SMB, that is short muscle belly. Then intermediate muscle belly, it is in between the short muscle and the long muscle belly. The belly of the muscle is the central bulging portion. It is fleshy portion of the muscle between tendons. The belly of the muscle is the central bulging portion. It is fleshy portion of the muscle between tendons. Coming to the fourth one, that is the tendon. Fourth one is the tendon. Tendon is a short, fibrous, non-elastic cord. Tendon is a short, strong, fibrous, non-elastic cord-like structure made up of connective tissue by the fusion of endomysium, perimysium and epimysium of end portion of muscles. The fusion of endomysium, perimysium and epimysium forms the tendons, which is a short, strong, fibrous, non-elastic cord-like structure. Next point, it attaches the skeletal muscles to a bone. It attaches the skeletal muscle to a bone. Example, the Achilles tendon connects calf muscles to head bone. Next point, it also attaches muscles to the structures of the body, for example, eyeball. Fourth one, tendons are a type of connective tissue made up of collagen fibers, which are building blocks of tendons. Collagen fibers are there in the Tendons. Tendons are capable of withstanding tension. They are capable of withstanding the tension. Next point, tendons transmit the force which is exerted by the muscles. It is not stretchable but allows the transmission of force exerted by muscle. Next point, the tendon injuries occur near joints such as the shoulder, elbow, knee and ankle. Tendon injuries occur near joints. Next point, in tendon the origin is fixed attachment and the insertion moves with contraction. In tendon the origin is fixed and the insertion is movable portion with the contraction. Now coming to the fifth one, that is aponeurosis. Aponeurosis. It is the modification of the tendon forming a flat, broad sheet, expansion or ribbon-like material. So aponeurosis is nothing but it is a modification of the tendon which forms a flat, broad, sheet-like structure or the expansion or the ribbon-like material. It anchors a muscle or connects it with the moving part of the muscle. It anchors a muscle or connects it with the moving part of muscle. It is composed of dense fibrous connective tissue containing fibroblasts and bundles of collagen fibers. Next point, it also provides attachment point for muscles to connect with bones. It also provides attachment point for the muscles to connect with bones. It envelops muscles and organs, binds muscles together and binds muscles to other tissues also. Next, they are important for muscle movement and posture. The aponeurosis are very much necessary for the muscle movement and the posture of the body. Now the sixth one is raphe. Sixth is raphe, R-A-P-H-E. Raphe. It is the intersection or a ridge found in the tissue or organ between two separate parts. It is a ridge-like structure or ridge-like tissue or organ between two separate parts of the body, two separate parts of the organs. It also a structure formed by the fusion of two ends of two flat muscle sheets. For example, anococcygeal raphe, mylohyoid raphe, phalangeal raphe, pterygomandibular raphe, then scrotal raphe, then perineal raphe. Scrotal perineal raphes are present. So it is, next one, it is a groove or ridge-like structure found in the organ or tissue making the line where two halves fused in the embryo. The two halves are fused by this groove-like structure found in the organ or tissue, making the line which shows the line where two halves fuse together. So this is called raphe. Coming to the anatomical movements. The anatomical movements of the body, anatomical movements present in the body, they are differently named and we have to study all the anatomical movements. The anatomical movements are described by anatomical terms which are used to explain the actions of muscles on the skeleton. the muscles on the skeleton movement or the action is termed as the anatomical movement, and this anatomical movement is for the action of muscles on the skeleton. Muscles contract to produce movement at joints, and the movement can be described by using terminologies. The muscles contract to produce movement. For the movement, the muscles will be contracted at joints, and the movement can be described by using different terminologies. Most of the movements have an opposite movement called antagonistic movements. Most of the movement have the opposite movements also, hence they are called antagonistic movements. Anatomical movements of the body are described in relation to the anatomical position of the body. So this depends on the anatomical position of the body. So anatomical movements can be described only with the anatomical position of the body. The first one is flexation. The first anatomical movement term is called flexation. This is a anatomical movement occurs in the sagittal plane. In the sagittal plane, these anatomical movements can be seen. That is the flexation. Next point, it is defined as the movement that describes the angle between two body parts. It is defined as the movement that decreases the angle between the two body parts. The angle between the two body parts is decreased, and this is called a flexation. Coming to the next point, it is the bending of a joint so as to bring together the part it connects. The bending of the joint is a flexation. Flexation at the elbow is decreasing the angle between the ulna and the humerus bones of the hand. So the flexation at the elbow decreases the angle between ulna bone and the humerus bone of the hands. When the knee flexes, the ankle moves closer to the buttock, and the angle between the femur and the tibia bone of legs gets smaller. The angle gets smaller. So this is about the flexation. Coming to the extension. Second one is the extension. It is the movement that occur in the sagittal plane. This is also the movement which occurs in the sagittal plane. It is just opposite to the flexation. So extension is just opposite to the flexation, and it is defined as the movement that increases the angle between two body parts. So here the angle between the two body parts is increased, not decreased. Whereas in flexation, the angle between two parts of the body is decreased. Here it is increased. Extension is the straightening of the joints. Extension is the straightening of the joints. So if you see this one, this hand, this is the flexation, and extension, this is the extension. Extension of the elbow increases the angle between the ulna and the humerus bones of the hand. Extension of the knee straightens the lower limb. When standing up, the knees are extended. The third one is adduction, ADDUCTION, adduction. It is an anatomical term that is used to describe movement towards the midline of the body. It is the movement towards the midline of the body or towards another part. Next point, the movement of the limbs that bring towards body across the midline. The movements of the limbs that bring towards the body is adduction. Adduction of the hip squeezes the legs. Adduction of the hip squeezes the legs. Ball and socket joints also allow adduction movements. Ball and socket joints allow together adduction movements. Coming to the abduction, abduction, abduction. It is an anatomical term that is used to describe the movements away from the midline of the body. So this is opposite to the adduction, opposite to the adduction and abduction. Abduction, in the adduction, it is an anatomical term. It is used to describe the movements towards the midline of the body, that is the adduction. But in abduction, it is used to describe the movements away from the midline of the body, away from midline. Second one, abduction of the shoulder raises the arms out of the sides of the body. Hip abduction is the movement of the legs away from the midline of the body. Hip abduction are important and contribute to stand, walk and rotate our legs with ease. Ball and socket joints also allow the abduction movements. So this is about the abduction. Coming to the medial rotation, the fifth one is medial rotation. It is a rotational movement towards the midline of the body. It is also called internal rotation. Internal rotation. Medial and lateral rotation describe movement of the limbs around their long axis. Next point, it is the rotation towards the body in which the anterior part of a limb turns towards the midline. It is the rotation towards the body in which the anterior part of the limb turns towards the midline. Next one, standing on straight leg and rotating the toes inward is medial rotation of the hip. Medial rotation of arm represents the movement of the humerus bone when the arm is lifted to 90-degree angle. The elbow is internally rotated around the longitudinal plane of the bone, which results the hand movement towards the midline of the body. Coming to the sixth one, lateral rotation. Fifth is the medial rotation. This is the lateral rotation. It is a rotational movement away from the midline of the body. So this is opposite to the medial rotation. It is in medial rotation, the movement towards the midline of the body. Here, the movement away from the midline of the body. It is just opposite to the medial rotation. Next point, in a lateral rotation, the movement of the anterior aspect of the limb turns away from the midline. Next point, the bending of neck or body towards the right or left side is the best example for lateral rotation. The bending of neck or body towards the right or left side. Bending of neck towards right or left side is the best example for the lateral rotation. Now coming to the seventh one, that is the circumduction. Circumduction. It is a conical movement of a body part. Example, the movement of ball and socket joint or eye. The ball and the socket joint is a conical movement and it is called circumduction, or the eye movement. The eye movement is a circumduction. It is a combination of flexion, extension, adduction and abduction. It is all the flexion, extension, adduction and abduction. They are all combined to form the circumduction. In this movement, one end of the body stays stationary while the other end moves in a circular manner. The circular movement of the limb or swinging an arm or fingers around is a circumduction movement. This movement can also be seen in shoulder, hip, wrist and joints. In all parts you can see this circumduction movement. Coming to the eighth, pronation. Pronation. It is a dynamic movement of the hand and foot. It is a anatomical movement of forearm in which it is rotated so that the palm of the hand faces backwards. Here the elbow is fixed and the forearm is horizontal and the palm is faced downwards. In other words, keeping the elbow and shoulder still, moving the hand into its front and palm downwards, which is a prone position, and the movement is pronation, and the movement is pronation, and the movement is pronation. Or the hand kept resting on the table in front, keeping elbow and shoulder still, turning the hand in its front, palm downwards. So this position is pronation. In the pronation, example I am giving, the hand kept resting on the table in front, keeping elbow and shoulder still, turning the hand in its front, palm downwards. So this position is pronation. Now the ninth one is supination. The supination movement, the hand kept resting on the table in front, keeping shoulder and elbow still, turning the hand in its back, palm upwards. This is just opposite to the pronation. Pronation, the opposite to the pronation is supination. This is opposite movement of pronation. Coming to the protraction. Protraction is an anatomical movement of body part in anterior direction, that is forwards. This type of movement is opposite to movement of retraction. This type of movement is seen in shoulder and jaws. The mandible protraction includes all the masticating muscles and act in extending forward from the normal position. When shoulder is moved forward for pushing something or throwing a ball, protraction movement of scapula bone occurs. The next one, 11th one, is retraction. Retraction. This is opposite movement of protraction. It is an anatomical movement of the body part in posterior direction, that is backward direction. This type of movement is seen in shoulder and jaws. In mandible retraction, the lower jaw is pulled backwards. When shoulder is moved backward, the scapula retraction occurs, which is a movement of scapula or shoulder blades towards the spine. Then the 12th one is elevation. Elevation is a upward movement of the body part or structure. In other words, it is the movement in an superior direction or lifting up. Next point, elevation of a shoulder joint raises the arm vertically upwards. Next one, elevation movement of mandibles during mastication to close the mouth. The last one, that is the 13th one, is depression. Depression. It is the anatomical movement just opposite to elevation. Elevation and depression are quite opposite to each other. It is just opposite to the elevation. It is a downward movement of the body parts or structures. In other words, it is the movement in an inferior direction or lowering down. It lowers down. It is the downward movement of the body part, whereas the elevation is upward movement of the body part. Upward movement of the body part. And here in the depression, the structure in other words, it is movement in the inferior direction, not the superior direction. In the inferior direction or lowering down. Lowering down. So this is about the anatomical terminologies. So these two chapters I have completed for the medical laboratory courses, that is the DMLT course, that is the anatomical terms. Yesterday only I have told the terms of describing the muscles, that are origin, insertion, belly, tendon, aponeurosis and the raphe. 6 terms which describe the muscles. Then anatomical movement, the names of the anatomical movement I have completed: flexation, extension, adduction, abduction, medial rotation, lateral rotation, circumduction, pronation, supination, protraction, retraction, elevation and the depression. So all these movements I have completed. So here we complete the anatomical syllabus for the medical laboratory courses. Still you have different part, that is the histology is there for you people. Tomorrow we'll take the histology, which is present for the DHI and DMLT second year students. Both courses they have the histology, hence tomorrow we'll take the histology and the other things. So here we close for day. Thank you.